Hi, everybody, and welcome to my presentation. This is for community health promotion, and it's on tick-borne illness prevention. Okay, so first things first, let's talk tick-borne illnesses. What are they? Well, they're exactly what they sound like. These are illnesses or diseases caused by ticks, specifically tick bites. So what happens is a tick latches onto you because it needs to feed on vertebrate blood, so animals, birds, mammals. So it feeds on your blood while it's latched on. Little pinchers are in your skin. He's excreting saliva into your body, and his saliva contains various pathogens, so bacteria, viruses, parasites. And some of these, or many of them, really can cause disease. They can cause acute illness or they can cause a chronic disease. There's over a dozen different kinds of tick-borne illnesses in the United States. There's upwards of 20 listed on the CDC's website. There are two families of ticks in New Hampshire. So in Hudson, as part of our community, you should know there's two families, but that doesn't mean that there's only two different types of ticks. The two families are really the overarching group of ticks. So we have hard ticks, the Exodidae, and then we have the soft ticks, Argazidae. So I'm going to focus on the Exodidae, and really it's coming down to the black-legged deer tick. For all intents and purposes, this guy is it's this little critter in this picture here. This is the guy that carries the most diseases and most of the ones that are affecting people in our community. So this slide here, I just wanted to show how can you identify different ticks. We have all of these ticks in our area. Lone Star tick is mostly associated with the southwest, but the numbers have been increasing up here, so you will see them at some point, especially if you're outdoors quite frequently or have pets. You may end up seeing these, but for the most part, you're going to see the American dog tick, the black-legged tick, and the brown dog tick. Really, the one that I want to highlight for you right now is the black-legged tick. So these are formerly deer ticks. These guys transmit anaplasmosis, babesiosis, Lyme, the bacteria that causes Lyme disease, tick relapsing fever, ehrlichiosis, and Powassan virus. Pretty nasty stuff. But you can use this slide as identification if you ever have any questions. If you are outside or a pet and you pull off a tick, you can see what kind of tick you have on you. What are the major risk factors for acquiring a tick-borne illness? Well, I guess the most common one is being bitten by a tick. So how do we avoid being bitten by ticks? Well, it's kind of hard because when you live in the Northeast, especially New England, we're automatically in an epicenter for tick-borne illnesses. We are basically ground zero for Lyme disease, for example, New England is. If you work or spend time outdoors, especially in wooded or grassy areas, so landscaping, if you're doing surveying, if you're working on lines, or you're an arborist, you're highly exposed to environments that are heavily laden with ticks. If you have pets that go inside and outside, that they go out into the woods, they go out into fields, they can come in contact with ticks and bring them inside. They can expose you that way. Now, after you get a tick bite, if you have a weakened or compromised immune system in any kind, you're at a slightly higher risk for developing a disease based on your tick bite. One thing I want to point out is that age, gender, race, they do not directly affect risk for tick bites. Ticks do not care who you are, what you are, how you identify. They see you as a source of blood, which is their food. They don't care about any of the other superficial, subjective things that we care as humans. That being said, for various reasons, including socioeconomics, demographics, age, gender, and race can indirectly affect the occurrence of an acute or chronic disease after a tick bite. I won't dive too much into that. It's outside the scope of this presentation, but just the overall key here is that your risk factors have nothing to do with who you are. It's mostly where you are. These are the top 5 tick-borne illnesses in New Hampshire. Obviously, number 1, Lyme disease. I think we'd be all hard-pressed to find one person in our life that we know that doesn't know someone either directly or indirectly impacted by Lyme disease. The next 4, anaplasmosis, Powassan virus, babesiosis, and hard tick relapsing fever round out your top 5 for most common or most frequently diagnosed tick-borne illnesses in New Hampshire. And all of these can be caused by this little guy again, the black-legged tick. So these little deer ticks can cause each one of these diseases. So a single bite could get you all 5, one, just a couple, but there's potential for all. In the next several slides, we'll talk about each of the top 5 diseases caused by ticks and what their signs and symptoms are. So the first one is Lyme disease. Lyme disease occurs in multiple stages in three. You have early localized Lyme. This is occurring about 1 to 2 weeks after the bite. This is where you're going to see that bullseye rash or a rash if you're going to get one. Keep in mind though, 30 to 40% of people won't actually get a rash. So don't wait to see a rash and assume that if I don't have a rash, then I don't have Lyme disease or I don't have a risk for Lyme disease. It's just simply not true. Not everybody gets that rash. So don't put all your eggs into that bucket. Early localized Lyme this is the stage where you're going to have those flu-like symptoms, those very vague symptoms, fever and chills, joint pain, muscle pain, body aches, a stiff neck. You're generally tired. You have that sore throat, fatigue, may or may not have a rash. Couple weeks to months after the bite, we're in early disseminated Lyme. This is where disseminating meaning it's actually spreading throughout your body. So localized, the infection is localized to where that tick bite occurred. Disseminated, it's now entering other body organs and systems. So it's all the symptoms from stage one, plus you have some neurological and cardiovascular symptoms. So on the neurological side, you're going to get some numbness. Maybe you have some temporary paralysis or weakness. It could be permanent as well. Meningitis, vision changes. And on the cardiovascular side, this is where Lyme carditis comes in. This is where you have that arrhythmia, chest pain. Stage 3, late disseminated Lyme. So this is months to years after the bite. This is where we're entering into chronic Lyme territory. This is where the disease is now widespread throughout your body. It's deep into your bones and your tissue, and it's affecting your nerves. So you have symptoms of stage 1, stage 2, but now you're getting into connective tissue and deep into your brain, so neuropsychological. So the key symptom here is migrating pains. This is something that people with chronic Lyme will frequently exhibit. You have pains that are not always in the same spot. Your right knee may hurt for a couple of days or weeks, and then your left knee, and then your hips will hurt, and then your shoulder may hurt. Maybe you have headaches that come and go. It's migrating pain. It's not always in the same area. You're also going to see neuropathy, arthritis. On the neuropsych side, you're going to have insomnia, changes to your mood and affect, brain fog. A lot of Lymies will talk about brain fog. They just can't quite find the word, or they can't quite make the thought out. You're seeing this a lot with the long COVID patients as well, this brain fog. Cognitive difficulties, it's getting a little difficult to learn, remember stuff, vertigo, dizziness. These are all symptoms associated with Lyme, and there are plenty more too. These are just the most frequent ones associated with Lyme. Going back to that bullseye rash, a lot of people seem to associate a bullseye rash with Lyme disease. Here are examples of other kinds of rashes you may see with Lyme disease. So they're not all bullseyes. The top left corner is the beautiful bullseye. That's the typical one you think of. Bottom middle, same thing. But take a look at the other pictures, especially the far right, the chew behind the knee. It looks like a big bruise, and on the clavicle there on your collarbone, it just looks like a really red infected bite. But those are all caused by Lyme disease, these rashes. I also showed pictures from black skin with the Lyme disease just to show that it's for those of us with darker skin, it's more difficult to see a rash if there's going to be a rash. Just based on pure presentation alone, a rash is harder. Any kind of rash, any kind of redness is going to be harder to see on darker skin. So you have to kind of look for different signs. So for example, that bottom left corner, you can see that there's a raised bump and it looks discolored compared to the rest of the skin. That middle top picture, however, it's a difficult looking bruise. The next most common tick-borne illness in New Hampshire is anaplasmosis. This one's on the rise. You're going to see this often in emergency rooms. There's early illness and late illness. The early illness is a couple of days to a couple of weeks after the bite, and the major hallmark symptoms here are severe headache with vomiting, diarrhea, and loss of appetite. You can't keep anything down. You just feel gross. So it's similar to the stage 1, early localized of the Lyme, in that you have those vague flu-like symptoms, but you also have a higher chance of having the vomiting, diarrhea, loss of appetite than you might with early Lyme. In the late illness, so this is weeks to months after the bite, it's entering a chronic stage. You may have severe systemic responses, including respiratory failure, bleeding and clotting problems, seizures, organ failures, and overall, you could die from this if not treated appropriately. Next up, we have Powassan virus. This one's a scary one. This one it can get severe pretty quickly, and it's super vague too. So catching it early is very difficult. So you have your general illness and you have severe illness. So again, separate into classes from the acute infection to a chronic or more long-term infection. So on the general illness, again, flu-like symptoms, fever, headache, general malaise. You may have some vomiting. You may have a rash along just the trunk of your body. fatigue, muscle ache, sore throat. And then a couple of days to a month after the bite, it's going to get pretty worse and it's going to affect you more psychoneurologically. So, on the psychological side, you're going to have depression, confusion, changes in your mood and affect. And on the neurological side, the severe symptoms would be muscle weakness, limb paralysis, usually affecting one side, but it can be both sides of the body. Neck stiffness, so this is kind of signs of like meningitis. You may also have dizziness, loss of coordination, trouble speaking, breathing even, memory loss, seizures, photosensitivity, nystagmus, which is these are abnormal eye movements. It's like when you look at someone's eye and it's kind of like shaking, it's vibrating. Something scary about this virus is if it's not caught, and again, it's a virus, so you're only going to treat symptomatically. There's no antibiotic for this or an antiviral. This is supportive care only. But 1 in 10 people that end up getting the severe form of Powassan virus die from it. And those who survive it, nearly half of them will have lingering health problems for the rest of their life, which include personality changes, muscle weaknesses, paralysis, headaches, and memory problems. Next up, we have babesiosis. This is caused by the Babesia family of bacteria. Babesia is a parasite. So there's just a general illness of Babesia. You can catch it early and hopefully eradicate it, but this can also turn chronic if not treated properly. So the illness starts a couple of days to a week or a few months after the bite. Generally starts with some flu-like symptoms, a high fever. So this is a hallmark of it. High fever, chills, sweats, especially at night. Night sweats are a huge symptom for Babesia after a tick bite. And then muscle and joint pain, especially your hip. On the respiratory side, you might hear something called air hunger. A lot of people with Babesia complain of this inability to catch a full breath. It's like they're always seeking a breath but can't quite feel fulfilled from the breathing that they have. GI side, you may have some nausea, vomiting, loss of appetite, and then neuropsych, depression, anxiety, fear, insomnia, and just generally autonomic nervous system dysfunction. So dysfunction of the things that your body does automatically for you, breathing, temperature regulation, sleep, those kind of things. The complications from Babesia are kind of scary too. This can be life-threatening. So one of the major complications is hemolytic anemia. And the symptoms of this are fatigue, dizziness, weakness, dark urine, yellowing skin, and whites of the eyes. This is extremely life-threatening and can kill you if not treated properly. And then in general, some other complications are low blood pressure, liver problems, and kidney failure. And once again, you'll notice on all these slides, I have this black-legged tick here because this little fella, he's causing all of these diseases that you're hearing about. And finally, rounding out the top 5, we have hard tick relapsing fever. This used to just be called tick relapsing fever or Borrelia tick relapsing fever. There's been different names for it, but it's caused from that family, the Exotidae. Hard tick relapsing fever, and it's exactly what it sounds like. It's an illness or a disease that is characterized by a fever that comes and goes, relapsing, right? And that you may not even have that as a symptom or as a presenting symptom, but you may still have hard tick relapsing fever. So the illness occurs pretty quickly for this one. It doesn't take a long time for it to build up in you. So a couple of days to up to a few months after the bite, you're going to have those general flu-like symptoms, the relapsing fever. This one's considered more of a novel tick-borne illness. There's still a lot of research going into its clinical presentation, meaning how is it being presented symptomatically? What are people experiencing from symptom side for this? And what are the characteristics of it? What is the actual timeline? How long can it last? There's conflicting beliefs, whether it's a purely acute illness or if it's purely chronic even. Treatment and then ongoing how to detect it. So there's still more research coming into this one, but it is number 5 in New Hampshire for diagnoses of tick-borne illnesses. So we've talked about the 5 top tick-borne illnesses in New Hampshire, specifically their signs and symptoms, and you know that they're all caused by this black-legged tick. So what do we do for diagnosis of these tick-borne illnesses? So you've gotten a tick bite, you're feeling sick, you're feeling crummy, you don't know what's going on with you, you go see your doctor. How are they going to figure out that you have a tick-borne illness? So the first thing they're going to do is basically interview you. They're going to talk to you and find out, okay, these are a lot of vague symptoms. Do you spend time outdoors? Do you have pets? Were you in contact with tall grasses? Were you in the woods? Do you hike? Do you fish? Are you just generally trying to pick your brain to see if you're meeting those early risk factors that we talked about earlier in the presentation, to see if perhaps you were bitten by a tick. Have you had a rash? Knowing again that not everybody gets a rash, but that's a really good pointer to say, okay, we're really leaning towards a tick bite here. So On top of that, they're going to test your blood. There's a few tests out there. Again, there's some controversy about the test. I don't want to get into it. It's out of the scope of this presentation, but just know that there is some controversy. But there are tests available out there through your doctors to see if you have tick-borne illnesses. They can test your spinal fluid too if they're concerned about certain tick-borne illnesses. Certain tick-borne illnesses show up in your spinal fluid more so than they'll be detected in blood serum. You can do imaging, so MRI, CAT scan, PET scan. This is to see the extent of damage caused by tick-borne illness if a tick-borne illness is suspected. And then basically, if it looks and sounds like a duck, it's quacking and it's walking like a duck, it's probably a duck. So all these things together, there's no real gold standard for diagnosis, unfortunately, for a tick-borne illness. You would think it would be, like, we talk about strep, or we talk about COVID, or we talk about things that you can detect pretty finitely with laboratory testing. We're not quite there yet with tick-borne illnesses. Again, there's controversy about how to test and which tests are truly accurate for determining if you have a chronic version of a tick-borne illness, for example. But a lot of it's going to be based on your clinical symptoms and risk factors. All right, so we have a tick-borne illness diagnosed. How do we treat it? Well, in general, it's going to be antibiotics, and it's going to be aggressive antibiotics. And the type and duration really depend on what the pathogen is, what's the severity of your symptoms, where it's displaying itself. Treatment for just simply having a rash and flu-like symptoms is going to be different. It's going to be less aggressive than if you present with Lyme carditis, for example, so an inflammation of your heart, or if you have what they call neuroborreliosis, which is inflammation of your brain caused by the bacteria that causes Lyme disease. So though, Lyme carditis and neuroborreliosis will be treated more aggressively than flu-like symptoms or early localized Lyme. So generally, they're the first line treatment. If you have a parasite, you can take antiparasitics. So that Babesia, they often use antiparasitics for that. And then on the viral side, so for example, the Powassan virus, it's really supportive care, meaning that you're supporting symptoms, you're treating symptoms. So take pain medication for pain. Use mindfulness, yoga, therapy, whatever you need for mental health. Address insomnia in different ways, whether with cognitive behavioral therapy or with medication specifically for sleep. So you're treating symptoms instead of treating the actual cause of this, because there are no decent antivirals out there that are targeting just that virus, unfortunately. Other treatments can be botanical or herbal. A lot of people with chronic tick-borne illness, for example, will use herbal antibacterials and antivirals after or in place of pharmaceutical antibiotics. And the reason for this is because there are less adverse effects associated with the herbal antibacterials. Long-term antibiotics, even for as little as a couple of weeks to a month, can really wreak some havoc on your system, especially on your digestive tract. They just completely throw off your microbiome, and they weaken you overall too. So a lot of people with chronic tick-borne illness will switch over to more natural treatments to kind of prevent that additional damage to your systems. And there's controversy around the treatment. So the purpose of that slide is just to show you the types of treatment that are widely available for those with tick-borne illness, whether acute or chronic. Not to get into the fine details of the exact antibiotic or the exact herbal or the exact treatment preferred route. It's just more of an awareness that this is how these are treated. They're not treated, with lasers or with any specifically targeting medication. It's just really kind of overarching generalized treatment. So the key here is those signs and symptoms are scary, and living them is even scarier. I speak from experience as someone with chronic Lyme. You don't want to be me. You don't want this at all. So the best thing I can do for you right now is help you prevent being bitten altogether, and just and on top of that, just being aware that tick-borne illnesses are a thing. They're not, it's not just limited to the friend that that has Lyme, or your friend's cousin or your cousin or whoever knows. It can affect you. And we live in an area where we are surrounded by ticks. We're surrounded by carriers of ticks. We need to do our best to help keep ourselves and our family safe. So There's different ways to prevent tick-borne illness. There is no vaccine available for tick-borne illnesses. There used to be one for Lyme. It got pulled. There's one in the works right now, which may or may not make it to the light of day. Again, I'm not going to dive into the controversy surrounding that, but there's no vaccine. So the only thing you can do to prevent tick-borne illnesses is to prevent tick bites. So when you're outdoors, wear long-legged and long-sleeve light clothing. So you can easily see ticks that are on you. So wear white shirts, white long sleeve shirts when you're outside, or light colored pants, so you can just really easily see ticks and pick them off. Tuck your pants into your socks. Wear hats. Frequent sites for tick bites are in areas where it's a little on the warm and moist side. So on your scalp, frequently this is how people miss rashes or miss tick bites. They've been bitten on their scalp, behind their ears, at the base of their head, around their ankle area. These are all really good entry hidden spots for ticks. When you're gardening, wear elbow length gloves. Don't just get those little gloves that go to your wrist. Get the elbow length ones, and we still wear those long sleeve shirts. So you can tuck the long sleeve into the really long glove and help prevent any ticks from getting into any exposed skin. The most obvious thing to do is avoid any known tick-laden areas. If you walk through a field, and every time you walk through that field, you walk away with 10 ticks on you, don't walk through that field anymore until it's been treated. When you're outside, try to walk in the center of roads, or if you're in paths that go through the woods, try to walk through the center of that path so you're avoiding any, or walking by and touching any grasses or plants that are kind of extending into the path, or avoid bumping into overhanging branches with leaves that are on the path. Try to stay kind of like in the center of that. And then there's different tick repellents that you can spray on yourself and on your clothes. So I list here that they're the ones that are safe for your skin. So up to 30% DEET, oil of lemon eucalyptus, and 10-20% picaride. And don't use the DEET on the kids, especially if you find something that's more than 30% of DEET. Just avoid it altogether for children. Same thing for oil of lemon eucalyptus, paramethane-diol. Don't put it on kids, especially those less than 3 years old. Do not use insect repellents of any kind on babies, especially those younger than 2 months. And don't spray insect repellents on your pets. For your clothes, you can get something called permethrin. That's super, super effective for killing ticks. And if you use someone like Mosquito Joe or some of the other tick spraying or lawn spraying pest companies out there, permethrin is usually on their list of chemicals if you ask to help keep your lawn safe from ticks. Just a note on the sprays too. So once you've sprayed yourself or had your lawn sprayed with any of these chemicals, wait for it to dry 20-30 minutes before exposing any of your pets to that spray. Otherwise it's toxic. You don't want them to be touching damp, wet sprays. So those are ways to protect yourself. It's called personal protective measures. Another step is to tick-proof your yard. So these two images here are really good examples of how to do it. So from the Mosquito Joe website, you want to avoid forest and brush, so keep that in the rim of the area that you traverse or that your pets traverse. Put deer-resistant crops along the edges too, if you are able to. So the fun thing about deer, so deer carry black-legged ticks. They're one of the major carriers of black-legged ticks. They carry black-legged ticks, but they don't actually carry Lyme disease. So a really cool study out of UMass Amherst found that there's something in deer blood that when ticks who are infected with Borrelia burgdorferi, the bacteria that causes Lyme disease, so ticks infected with that bacteria, they noted that once they fed on deer blood, so white-tailed deer blood, they actually no longer had that bacteria present. There's something in their blood that actually kills Lyme disease. So as much as we like to associate deer with Lyme disease, it's very indirect because they're actually, the ticks that bite them actually no longer carry that bacteria. Very interesting stuff. But they still can carry the ticks who can hop off, get the bacteria, and then find their way to you before they find their way to another deer. Keep your grass mowed, trees trimmed. Keep any leaf debris away from around the house, especially dry leaf. In the fall and spring when you're doing your gardening, you have those dry leaf piles. Those are really easy targets for ticks to be hatching from and living in. And then over here on the right-hand side, you can see this is a really good idea to create a really tick-free zone. They suggest creating a 3 foot wide or greater barrier, and you can use bark mulch or wood chips between wooded areas, high grass areas, and your yard. So you're eventually creating a tick safe zone and then a tick zone, as it shows here. So you've done you've tick proof your yard. You've used protective personal measures when outside. So you're spraying yourself, you're wearing the long sleeved clothes, you're tucking your pants into your socks. Now you're going to come back inside. So what do you do? What if you have a tick on you? So when you transition indoors, there's some easy things that you can do real quick to kind of help prevent any ticks from staying on you and giving them an opportunity to latch on and bite you. So change your clothes when you come inside. First thing you should do, if you're able to, is take your clothes off, throw them into the wash immediately, or just leave them outside. Leave them in the garage. If you have garden clothes, leave them outside somewhere. Leave them somewhere away from indoor spaces so they can't crawl around and find you or your pets. Something to note, if you're going to wash and dry exposed clothes, you need to use high heat for at least 10 minutes. Cool to warm water at any length of time is really insufficient to kill these little things when they're latched on. You really need that high heat. Shower. So you take out your clothes, throw them in the wash, jump in the shower. Studies have shown that showering within 2 hours of coming inside after spending a decent amount of time outside will reduce your risk of tick bites. And then finally, check yourself and check your pets for ticks. And the way to check yourself is you want to check these areas especially. So like I mentioned earlier, ticks like to hide. They like to find areas that are a little on the warm and damp side. So around your hairline, this is perfect. We carry, heat leaves your body through your scalp. So it's a very warm area for them. So check your hairline, inside your ears, behind your ears. This is the same thing for pets too, even though this is a picture of a little girl. This is the same places that you would want to check your pets as well. The back of the neck, your armpits, inside your belly button, around your waist and your groin area, up in your thighs, on your legs, behind your knees, and between your toes. These are all great places, really frequent areas that ticks will bite. Uh-oh, so let's say you found a tick. You have a tick, it's attached to you. What do you do? Well, first thing, don't panic. Next thing, grab a pair of tweezers. And what you're going to do is grab the tick by its head and you're going to pull straight up. This is the best way to get the pinchers to kind of depress or release from your skin. You don't want to pull sideways or wiggle around. You just grab them and pull straight up. Wash your hands, wash the tick bite with rubbing alcohol and soap and water. And then what you can do too is note down the date and the time that you found that tick. And then just kind of keep track of any new symptoms. Especially you're going to look for a rash, knowing that not everyone gets one, but look for a rash, fever, any flu-like symptoms. These are the things you want to be aware of. So that way, once you experience them, you can associate that with, oh, I was recently bitten by a tick. I need to go see my doctor. Honestly, though, I would recommend that after a tick bite, just make an appointment with your primary care provider anyways. Just give them a heads up. Don't wait for the rash again because you may never have one, and you don't even need to really wait for the symptoms. If you find a tick on you and it's been lodged on you for quite a bit of time, it might behoove you to be proactive and see your physician to see if you can get any prophylactic, meaning preventative care, so antibiotics basically to help kill anything that may be brewing. And then if you have any of the severe symptoms after a suspected known tick bite or after just being outside in general, if you have any severe symptoms like seizures, super high fevers, we're talking about like 102 higher, an irregular heartbeat, uncontrollable nausea, vomiting, diarrhea, and loss of appetite, go to the emergency room or call 911. Don't mess around with these things. Again, the key is you don't want to be me. You don't want to be someone with chronic tick-borne illness. You want this out of your system as soon as possible so you can live a nice full high quality of life. Next few slides are resources that can help you out if you have any other questions or if you are looking for additional support. So Tick Free New Hampshire is a great organization. They're affiliated with the Department of Health and Human Services with the state of New Hampshire. They're a nonprofit organization. They have really, really great stuff there. I really encourage you all to take a look at their website. The New Hampshire Department of Agriculture, if you need help identifying your tick, here's a link for you. Tick-borne disease information. This is straight out of our Department of Health and Human Services that can give you kind of breakdown similar to what I showed you, signs and symptoms of different tick-borne illnesses. And then when you're in waiting rooms at your doctor's offices, or if you're going to a specialist, if you see a naturopath or a functional medical doctor, you'll often bump into people with tick-borne illnesses. Pick their brain. This is the best way to build a community, is connect with people who are also suffering from something similar if you end up having a tick-borne illness. If you have a tick-borne illness, or if you're interested in tick-borne illnesses, these are online resources. ILADS, International Lyme and Associated Diseases Society, has really great research and information about tick-borne illnesses. The Tick Management Handbook, this is really cool. It's an older resource. It's from the state of Connecticut. They put together a really great handbook about how to manage and prevent tick-borne illness and tick bites, and how to tick-proof your yard. And then just in general, if you're interested about different things associated with ticks, the extension at UNH has a great resource about ticks. More support groups here. If you or someone you know has a tick-borne illness and is looking for a little bit more support, these are some great spaces to check out to see if any of them fit what your friend, your loved one is looking for. Here are the references. You're welcome to go through them. And then I ask if each of you, after reviewing this presentation, if you could fill out the Survey Monkey for me. I really want to get a feel for where we as a community stand when it comes to tick-borne illnesses. You know, what's our knowledge base like? How many of us either have it or know somebody who has a tick-borne illness like Lyme disease? This is really valuable information that I plan on sharing with the state of New Hampshire to kind of help in my lobby for our state to provide better diagnostics, better testing, and better treatment, whether that's in the form of research or money into organizations like Tick Free New Hampshire that can help prevent this from occurring. So again, I thank you so much for watching this presentation. Please feel free to reach out to me if you have any questions, any comments, and I really encourage you to take a look at those resources that we have on the end slides. And best of luck to all of you. Thanks.